AFMC is really known.
And also make sure
Hello and welcome into this week's edition of AFMC TV. We're so glad you're joining us. Would you know what to do if you were on any body of water and saw someone in distress? Do you know CPR? Do you know how to operate an AED? Well, today we're going to try to get some of the answers to those questions. Joining me now is Lori Arnold from the American Red Cross here in Little Rock. Lori, thank you for joining me today.
Thank you very much.
Okay, let's start off. What are some of the basic first aid and CPR life-saving skills we need to know?
Well, because emergencies can happen at any time and any place, it's important to follow 3 basic steps to action first.
Okay.
Check, call, and care. So check the scene for safety and then check the person.
Okay.
Call 911 or have somebody else call 911, and then care for the patient who is injured or wounded until help arrives. If we're talking about CPR very specifically, there are 2 components. There's rescue breathing and chest compressions. However, if someone is untrained or uncomfortable with rescue breathing, they can do chest compressions only continuously until help arrives.
Okay, so what are some of the signs that we should look for to determine if somebody is in that emergency situation?
So as a general rule, if somebody is either injured, ill, or unresponsive, if they are severely bleeding, have been severely burned, if they appear to have been poisoned, or if they're having difficulty breathing or chest pain or pressure, call 911 immediately.
What if somebody can't articulate that they are in distress?
Then you definitely know that that is time to administer CPR and first aid.
Okay. Now, I know you're not a certified CPR trainer. You are certified, but you're not a trainer. So are there just some things? I know compressions are different. You've already mentioned if you're not comfortable with what in the old days they used to refer to as mouth to mouth.
Right.
What are some, how do you stay calm in that situation?
So it's very important to remain calm. Again, call 911, make sure that you've got help on the way so that you don't have that additional burden. But just take those breaths yourself. If you get tired while giving CPR and those chest compressions, have someone come in and fill in for you. Every single second counts. When you're giving chest compressions, you're pumping blood through the body, and that's keeping the vital organs, including the brain, alive. So keep those chest compressions going at all times. And if you get tired, have somebody jump in for you.
What if you're afraid I'm going to hurt them?
So that's a really great point. Luckily, here in Arkansas, we do have what's considered it's commonly called a Good Samaritan law, which says that any person who is present at the scene of an accident or an emergency, who is not a healthcare professional or CPR certified, if they, in good faith, lend emergency aid to lessen or remove the immediate threat of life, they won't be held reliable for damages for assisting.
Okay. What if they think, gosh, sure, we all work out, wink, wink. But could I do it hard enough to make a difference?
So this is why it's really important to get certified or to get CPR trained. It's very difficult to know if you're doing it right without having ever been instructed or shown how to do it. However, we know that this happens, and sometimes you haven't been trained and an emergency arises. So we recommend that people actually download the Red Cross First Aid app. It's a free app, and it does give step-by-step instructions on what to do and how to administer CPR if necessary.
When I went through CPR training, one of the things that they told us were to do the compressions to the song, the old Bee Gees song, Staying Alive.
I heard that too.
Is that still, can that still work? Is that still, if that's what comes to your mind?
It does still work, yes. And I love that it's Staying Alive too, because it's completely connected there. But you do want to give about 100 to 120 compressions a minute. And so a nice fast-paced song like that helps. Just remember that when you are giving those compressions, to let the chest fully rise before the second compression.
Okay. Let's talk about the AED real quick. Difficult to stick on, or is it pretty self-explanatory if you're in that crisis situation and maybe you don't know how to do an AED, but you know how to read?
Right, okay.
And follow instructions.
So of course, first I have to say it's much better to get trained on this AED because they're an electronic device and they're very serious. But every AED will have step-by-step instructions in the packet when you open it. It'll have fresh pads for pressing onto the chest, and it will give you step-by-step instructions. And the AED itself will talk to you. It will tell you, it'll give you a countdown to stand by and things like that. Because we're talking a lot about summer and water safety, it's very, very important too that if you are at a pool or anywhere that there's water, be sure to completely clear any water and pooling of water around the patient before using an AED.
You know, it's every summer we hear the horrendous story of someone at a pool that drowns. And what a great way to help prevent for that to happen. It's somebody in the crowd knowing CPR. How can they reach out to Red Cross? How can they sign up for classes?
So if you want to sign up for a Red Cross class, we recommend that everybody get some sort of first aid, CPR, and AED training. You can go to redcross.org/take-a-class, and there you can find locations, information, and you can get registered. You can also call 1-800-RED-CROSS and choose the training prompt. The classes are both online. You can have an online class or an in-person class. However, it's important to note that if you do need a valid training certificate for workplace certification, it does have to be an in-person instructor-led class. However, if you're wanting to learn CPR just for your own safety and for your own family's safety, both methods are extremely effective.
Lori, is there anything else you would like to add that we haven't touched on?
One other thing I'd like to add. You mentioned drowning a second ago, and I think this is really important. If you see someone drowning this summer at the pool, the beach, the ocean, wherever you are, keep this phrase in mind. Reach or throw, don't go. So you don't want to put yourself into danger. So throw something out to the person, ask them to grab on. Then, again, keeping yourself out of danger, try to remove them from the water, and then, if necessary, begin resuscitation.
Very good, very good. And it is important to note, CPR isn't just for accidents that may happen around bodies of water. A toddler could choke on the skin of a grape, and you need to know how to be able to handle that.
That's right.
All right, Lori, that was great. Great information. Thank you so much.
Thank you.
Rebecca Denniston is with us, dermatologist, and we are going to talk about winter skincare. I mean, It's cold outside.
It is.
Yeah. So how should our skincare routine be changing up? I mean, obviously, we really shouldn't be doing probably what we were doing in, I don't know, August, September.
Right, exactly, yes. So for sure in the winter, your skincare needs to change. And a lot of it just has to do with, it's not as humid outside, the air's drier, it's cooler, and your skin will see those effects. So you're going to get drier. Your skin may get more irritated or sensitive. So you definitely want to make some changes. A lot of people just think, well, I need to make changes on my face, but you really need to do your whole body.
Okay.
So some basic things.
Please.
Easy things like using a more moisturizing soap to bathe with. And then when you get out of the bath or the shower, kind of pat dry. And then you want to do a thicker moisturizer. That's probably the biggest change you want to make. So in the summer, we tend to stick with a lighter moisturizer, something not as heavy, so more lotions. But in the winter, you want to switch more to a cream. So something that's thicker, going to hold in more water and give you more moisture.
Because the whole point is to help you help your skin stay hydrated.
Yes, exactly. Exactly.
Yes. What are some common misconceptions that people have during the winter months with their skin?
Yeah, so I think there's a couple. One being that you don't have to change your skincare routine, but you really do. So that's probably the biggest thing. And then the second biggest thing would be sunscreen. So yes, so we think, okay, we're not in the sun as much anymore. We may not be at the pool or the lake, but you really still do get sun in the winter. So just walking to and from your car, driving in your car, if you're playing outside, even though it may be cloudy, you're still getting sun. So really still being diligent about wearing your sunscreen is a big thing.
That's really good because you're right. We aren't at the beach generally. We're not at the pool. We are dreaming of those days.
Yes.
And so, no, I wouldn't think on a cloudy gray day that I need to have sunscreen on my face.
Yes.
So, what about those overnight I don't know, you see them, gloves and socks
Yes.
that have moisturizer or some kind of lotion in
Right.
them to keep your hands and
Yes.
feet hydrated.
Yeah, I think that's great because a lot of times the first place that you see that lack of moisture is your hands and your feet. They tend to dry out really quickly, and especially now we're washing our hands all the time. And so what I usually suggest to my patients is doing a good thick moisturizer, and then you can also add in an emollient like Vaseline or Aquaphor,
Okay.
and then put a pair of gloves or socks on.
Okay.
If you can sleep in them, that's great. That's a quick way to add moisture back to your skin. So definitely something that can help for sure.
What about humidifiers? Are they a good this time of year? Do they help, or is it a double-edged sword because it's taking moisture? I don't know.
Yes, definitely. So they for sure help. They're going to add that moisture and humidity back to the air that we would have lost. And so I definitely think there's benefit, especially if you're struggling with dry skin. 100%, I think that's helpful.
And then I'm curious, when do you know if it's dry skin, you're itching, you're scratching, when do you know that it's dry skin versus like some type of skin
Like eczema or psoriasis or
disease
something
of
like
some
that.
sort?
Yes.
Yeah.
Great question. So a lot of times just normal dry skin will respond to good thick moisturizers. So if you're doing creams, you're doing Vaseline, Aquaphor, that should really improve your skin pretty quickly. If you're not improving and you're really struggling with dryness, redness, sensitivity, itching, then there might be more of an underlying eczema going on. We see that very commonly on the hands, but you can get on other places of the body too.
What's the big thing that you guys see this time of year in your office?
Yeah, well, I definitely think probably the number one thing is eczema because you're losing that water in your skin. You're going to break out quicker because the air is more dry. So that's probably the number one thing. We see a lot of rashes, just more sensitivity and irritation in the winter, and then psoriasis flares. Psoriasis is more of an inflammatory rash of the skin. And so a lot of times in the winter, that gets worse as well.
Going back to the eczema, is that something that once you have, you always have, or does it work itself out and go away?
So interesting question. Some people are born with eczema and they may keep it throughout their whole life. And then some people don't develop it until later on in life.
Wow.
So there's really no rhyme or reason to it. You may have it as a child and then it get better, or you may get it as an adult. Yeah.
Okay. And I'm wondering too, hydration, just with good old fashioned water, is that going to help? Your skin
Definitely
as well.
Yes.
I mean, just like it would in the summer. I guess.
Yeah, for sure. Staying hydrated definitely helps. Lots and lots of water. I think if you do that in combination with good moisturizing soaps and creams and Vaselines and all of that, you really should do good. But if you're not and you're struggling, like I said, definitely you want to see your provider.
Okay. All right. Becca, thank you. Remind everybody where we can find you.
Yes, so I'm at the Dermatology Group of Arkansas. We have about 6 locations now. So come on in and we'll get you checked out if you're having issues. So
Sounds great.
yeah,
All right.
thanks for having me.
Thanks for coming in. Today we are talking about the dangers of sitting too much. We've brought in Dr. Beth Milligan, one of the physicians here at AFMC, to help us dissect some of the dangers when it comes to sitting so much. Hi, Dr. Beth.
Good morning.
So, Dr. Beth, regardless if we're working remotely or in an office space, what are some of the dangers when it comes to sitting so long for 8-9 hours a day?
They directly linked sitting too long with chronic medical problems, increased diabetes, even increase in cancers, some cancers.
So, to say we need breaks is probably an understatement, right?
Absolutely, we need breaks. We need to stand more, that's for sure.
So, I'm curious the correlation between sitting too much and some of the chronic health conditions. Any indications how those are linked?
Well, it's pretty much a simple answer. When you stand up and you move, that actually helps the blood circulating through the heart and particularly the colon. So if you're not moving around and you're sitting too much, you can't really even move the colon around, and people tend to have more gastrointestinal disturbances because of it.
Okay, so how long should we be getting up? How often? How long should we be walking? What are some of those numbers to just kind of keep everything moving correctly?
Well, you'll get different answers depending on who you ask, but some people are saying for every hour you need 15 minutes where you stand up and walk around. Well, a lot of jobs won't allow that, and students cannot do that. So then they'll turn around and say, well, if you sit all day, then you need to come home and you need to get 90 minutes of exercise where you're walking around and getting your heart rate up.
You bring up a good point when you touched on students. What kind of impact is sitting all day in the classroom? And I'm particularly thinking of our elementary age students, the ones who are still in their early developmental years.
Well, that's a very good question. Particularly with children, we run into issues where they sit too much, and they tend to have more problems with weight. And that's been a problem we've run into. And inactivity, obviously, through our younger years, increases the chance of developing chronic medical problems much earlier on.
All the more reason why recess is so important, right?
Absolutely, absolutely.
Okay, so if we notice that we are sitting too much, because sometimes it's out of habit, and we may not even realize just how much we're sitting. Can sitting too much also contribute to maybe lower back pain, tight hamstrings, problems with our hips?
Yes, correct. They've actually did a study of people who sit a lot on their jobs and things. So actually shorting that hamstring in the back, the big muscle down the back will shorten. So when they stand up, it hurts. And then because it hurts, they sit down more. And that's the opposite thing you need to do. And it scares people. And then they start developing other problems like lower back problems. If the chair isn't sitting right and they're slumped down too long or their necks are down, they'll start having neck pain because they're hunkered over the computer. And a lot of people are at home working and they don't have those ergometric keyboards and computers where you can sit to stand. That's all gone. So as a result, they have all these other problems that we're starting to see now from just sitting too long.
Are there any stretches that we could do, just basic stretches, to help with working out any of the kinks?
Well, I think I'd first of all saying if you're in a position, unless you're on camera with Zoom meetings, you actually can get your arms and actually move your arms around and do some exercise in the upper body if you're forced to sit. Another thing I've actually seen people do, if you can, is they'll put a special thing at their computer where they can pedal a stationary pedal on their legs to keep their legs moving. And I have seen someone do that recently, and I said, that's really impressive. I need to do that myself. But you can actually do some movements there at the desk. Now, once you're able to stand, you actually want to do a stretch to the hamstrings being the big leg muscles in the front and the back of the leg. You need to gently, bend over and stretch down as they've taught you, even before you're going to run, and probably do it right after you stand up to try to get that mobility back where you're sitting so long.
Can we talk a little bit about some of the kinks in the chain, so to speak? When you're sitting, you have a kink at your hips and you have a kink at your knees. And maybe talk a little bit about how that can inhibit the blood flow from your toes to your knees to your hips and back down.
You brought up a really good point. When we sit too long, you actually increase the risk for that blood to pool down in that leg because you have to get up and move. Even young people can have blood clots in their legs, especially if they're a little bigger and they have little health problems. You're setting yourself up for a blood clot. So you want to keep that. And so the blood will pool down in the leg and you can get a blood clot in the lower part of the leg. And that's the first place it goes because it's bent. Now, since you brought that up, I'm going to go ahead and answer a question is support stockings. And I actually own those myself because I have high blood pressure and some few things that makes me at risk for blood clots. So I do wear support stockings, and you can get those at a lot of different places. You can buy some of them that'll get you up in the compression level you need to squeeze that blood up while you're sitting so long.
All things that we need to be thinking about as we age and as we move into more of a remote type atmosphere, sitting all the time, not really going out as much.
Correct.
Okay, well, Dr. Beth, is there anything else you'd like to add?
I think it's just important to keep yourself motivated. If you find yourself sitting too long, it could be connected with other medical problems. You might be depressed or things are not feeling good. So be sure if you find yourself doing that, you can't get up and moving around, to go ahead and seek a medical advice and find out what you're doing that maybe is causing you to do that.
All right, sounds good. I'm telling you, after this conversation, it makes me want to go run. So
You do it.
Thanks, Dr. Beth, for talking to us about the dangers of sitting too long.